Good afternoon. On behalf of the Alumni Association of the University of California, San Francisco, the Greater Good Science Center at UC Berkeley, the Mindsight Institute, and the UCSF Department of Psychiatry, thank you for joining us today for the first in a series of webcasts. Today's webcast is titled Emotional Resilience During the COVID-19 Crisis, Practices for Healthcare Providers. I would now like to turn it over to our host, Dr. Elissa Epel.
A really warm welcome to all of you. We are just so grateful to be able to be with you in these critical moments. It seems like each day of this COVID era feels like 3 or 4 days. It's been a really long 3 weeks for everyone. I am a professor here at UCSF. I am a researcher in stress science. I also like to say I'm a stress scientist and a stressed scientist. And so I'm just so happy to share with you some science-based tips, and we hope that what we present is helpful. We're all bombarded by so much information every day. So take what is helpful, leave the rest behind. So this webinar today is going to be an 8-week series to help us through this period. We are focusing on health providers, healthcare providers of any type, mental health, and everyone who's working in the hospital and everyone who is out there with critical roles, keeping our society running. And for those of you doing shelter at home, some of this may be helpful for you as well, as this is a challenging time for all of us and we need new ways of coping. I'm just so pleased to really be able to share my wonderful colleagues with you, and let me introduce them. We have today Dr. Eve Ekman, who is a alumni of UCSF. When she was a postdoc here, she was studying stress resilience in medical residence. And she's also a senior fellow at the Greater Good Science Center at UC Berkeley. And my other colleague, Dr. Dan Siegel, who is a clinical professor at UCLA. And he has written at least 12 books, many of them bestsellers, so many of you know him. And he really brings to the public the science of the mind, how the mind works and how we can use it for better well-being, relationships, parenting. He'll be visiting us again, talking about thriving at home with children and adolescents in this time, surviving and thriving. All three of us lead workshops together on preventing burnout and stress resilience strategies. Today's a bit different. What does mental health look like today in the middle of an acute crisis? So I just want to begin by saying we really were quite moved by the questions and the tips that you offered. So each week there'll be an opportunity to send in questions, and it was with one question I show you, you'll understand that this represents hundreds of questions. So I'm going to show you our first question. Okay, I trust you see the Golden Gate Bridge. So I'll read it. I'm in uncharted territory. Usually I'm helping someone else manage crises while I'm regulated and calm. I feel like I'm right there with them. We had many questions like this. We had many comments from leaders. This is getting to the vulnerability that we all share, whether you're the most stress resilient person or not. A second common comment was, how do you feel like a valued physician when you're stretched to your limits? The hospital wants more from us, yet there's no more to give. So we're dealing with unprecedented times, times of uncertainty. There's no better formula for driving up our stress response, our threat response. We're dealing with times of moral distress, where our healthcare providers are having to work in institutions that are under-resourced. And this creates this moral distress of being put in situations that violates your integrity, your belief systems. So this is a remarkable moment where we just need to do our best. And what does that look like? What is mental health? Does it mean we're calm and relaxed right now? No. We're going to be living with anxiety for several months. So we need to use it well. Here's a model, a slide by Bruce Perry. He'll be speaking with us soon, trauma expert. And the model just contrasts for you types of stress. So on the pink side, you see that chronic unpredictable stress, when we don't feel control, leads to vulnerability. It shapes the brain so we're more vulnerable to depression, anxiety, post-traumatic stress symptoms, and worse health. And on the other side, what we see is positive stress. When stress is more moderate, when we can control it, we can develop stress resilience. So that's where we need to go right now, is how to shape our day so that we are feeling that the stress is not chronic and unrelenting and unstopping. Because in reality, nothing is monolithic. We have different states during the day, and we need to consciously and effortlessly regulate our states so that we're having stress, recovery, pause, stress, recovery, pause. And that pattern, our body's well equipped to deal with. So what does your day look like? When you have a work day on the front lines, what's typical is an acute buildup because we're so exposed to excessive demands and to threat cues and to news. News is another way that that COVID gets under our skin to create panic and anxiety. So we need to titrate our exposures. So here you see two different profiles. One person is having an increase in anxiety throughout the day that builds up. That's natural. If we're not regulating effortfully, that is where we're going to be at the end of the day. We go home, the anxiety is contagious. We're affecting our family, our housemates. And of course, how are we going to sleep when we go to bed in a hyper-aroused state? And so sleep is a real challenge right now too. We'll talk more about that later. The other profile, you see the person increases and decreases in anxiety. They end up with a little bit of higher anxiety, but this is a stress resilient profile to enter a day of, for example, helping patients in the ICU and to leave that day in a more regulated state. How do we do that? This is not about two different personalities. That blue bar is not a stress resilient person. They use strategies. They use pauses throughout their day to self-regulate. Those pauses are whatever works for you, and we're going to suggest some today. So another very common set of questions. How can I manage fear and anxiety so that it doesn't negatively affect my work performance? I need to focus. How can I use my fear in a productive way? This is where the rubber hits the road. We will have anxiety. We will have real threats. How can we harness that energy? Eve Ekman is going to talk about working with very difficult emotions. And Dan Siegel is going to be leading us through an exercise, a type of meditation that's very visual and very powerful. It helps a lot of people. And I'm going to talk about these short bursts of self-regulation when we only have a minute or two. So, but first I'll just note daily essentials: getting enough sleep, staying hydrated, taking water with you, keeping our blood sugar stable so that we're eating frequently whole food snacks. Those are challenging in the type of workload that our providers do. And so we need to support them also. How can we step up and be more helpful? Sufficient sleep doesn't happen very easily, but especially if we're exposed to the news before bed. So creating a COVID-free environment as soon as we get home is important. Social connection is the most buffering aspect of life we have. Feeling that we have someone to talk to, just hugging someone, these are very important now. And we already know that. I'm going to suggest something new to you, which is that you designate your own touch point person. So for dealing with the type of work you do, whether it's sitting with appointment after appointment on Zoom, helping people be screened medically or helping them with their mental health, or someone who has a similar job to you, and connect with them every day, could be text, could be FaceTime, to say to them, how are you doing today? Share something mundane, share something profound, witness each other's experience, hold each other's experience. This is profound peer support that we need in these days. So I hope you're thinking about who that person might be, and that you can text them and say, do you want to be my touch point? Oh, and they can live in a different state. Okay, next I want to move to stress resilience tips. I'm going to briefly review 3 what we're thinking of kind of psychological first aid tips, things you can use in the moment. A challenge mindset, awareness of emotion, so emotion labeling, and physiological grounding. Fancy names for very simple things, simple but not easy. This slide from my colleague Wendy Mendez at UCSF shows how fantastically fascinating stress is. These 2 mammals are at the peak of stress, but they're having totally different psychological and physiological responses. So they're high aroused. Lion is thinking this is going to be the best dinner all week. He's having tremendous oxygenation to the brain and some positive emotion. Gazelle is thinking this might be my last run. He's having vasoconstriction and less oxygen to the brain, not thinking as clearly. Our thoughts drive the type of stress response we have. So when we talk about the human good, bad stress response or threat challenge response, I typically show this slide. Feeling like you don't have what it takes creates this threat response. Feeling like you have what it takes creates this positive challenge. I can do okay. I can help people. And these words I have here just don't fit for this crisis. Hopeful, excited, confident. No one feels that way right now with these frontline jobs. And so we need to be creative, and we need to find the statement that works for us and use it over and over, because these are tips that take off 5% of the anxiety, that relax our nervous system 5%. So we need to keep using them over and over. So I'm hopeful that things will go well. I'm excited that I can play a valuable role. I'm confident that I'll do my best given the limitations. No one feels like they have what it takes for solving any of the problems we're faced with. But so what does it mean to you? I have what it takes in that I have my community behind me. I have my touch point person. I have my will to do the best I can. So thinking about what statement it is for you. Now, what research has shown, Wendy's and others, is that when we think about this physical stress response in a positive way, it becomes positive. The mind controls the body changes the mind. So in this case, feeling the stress response when you are in these situations each day and saying to yourself, this stress response is helping me. This is helping me cope. I'm rising up to the occasion. I need this. Thank you. This stress response is oxygenating my brain. It's revitalizing me. This is good stress. Just reminding yourself of that makes it more true. We've done studies, one we recently published, showing that mindfulness training does help us have this more positive emotional and physiological response. So this first one is from us, from our research. My stress response is working for me. It's not something to be afraid of. We can recover. Stress recovery, stress recovery. And in fact, it cleans out our cells and in some cases slows our aging. So positive stress, manageable stress is good. And these other statements are from you. These were thoughts you already naturally have when coping that you wanted others to use. And I think they're gorgeous. I'm doing the best I can right now. This is the most meaningful thing that I can provide, that I can do. We will get through this together. There are 2,700 of you together right now listening to this. You are all suffering in similar ways. We're all trying our best together. So I'm going to mention another strategy, which is it's simply labeling emotions. When we feel bad, overwhelmed, this is a really big monolithic negative cloud that doesn't actually help us cope. In fact, it makes our body go on alert, stress alert. So when we can actually sit down, I'd like you to do this with me, and take a deep breath and just ask yourself, what are the feelings in my body right now? What emotions do I have? There might be many. Naming your emotions, angry, fearful, actually changes the brain activity away from the limbic emotional brain toward the more thinking brain, the prefrontal cortex. So walking around feeling overwhelmed, you know what that feels like. taking a break and labeling emotions is going to be helpful. Not deep processing. It's not a time for that, but it's rather a time for a quick check-in for self-regulation. So what do these quick check-ins look like? You might call them positives or check-ins. So let's do this one together. Check-in you can do in any moment of transition in your workday. It's simply tuning into your physiological experience. What sensations am I feeling? Can I feel my feet on the ground right now? Can I feel my hands? Can I feel my heart? Changing our focus from the swirl of thoughts to our body, again, changes our mind state, changes our blood flow away from the limbic system. Now I'd like us to move to a breathing exercise, which is more powerful than the check-in. So if you have a few minutes, use a breathing exercise. You might have your go-to one. I'm going to show you one that Andrew Weil teaches his integrative medicine practitioners. It's a yogic method of breathing. I'm calling it 4-6-8. And we're going to do the first one together. And then I'd like you to do 2 more on your own. So if you have 2 minutes, when you get in the car, before you get out of the car, between patients, try this. So we're going to inhale for 4. 1, 2, 3, 4. Hold your breath for 6. 2, 3, 4, 5, 6. And exhale fully for 8. 2, 3, 4, 5, 6, 7, 8. The trick here is not the exact numbers. You can do what works for your pace, but to have a longer exhalation. When we exhale fully, we send our body a strong message. In this moment, I am safe. In this moment, my nervous system can relax 5% more. So now I'd like you to try this again on your own 2 times. Do you feel even a tiny bit different? Have your shoulders relaxed? When should you do these pauses? You might schedule them into your calendar. You might try to think about all the different points in your day when you're transitioning. Maybe you're washing hands. Maybe you are having a lunch break. So one thing to think about is institutionally, how can you do this in your work group? How can you create pauses for people? Having appointments every single hour back to back is going to create that stress buildup. So we need to think really creatively. This is more marathon than sprint. We're in this for months. How can we create a day where we can build stress resilience rather than sensitization? Before I turn it over to my colleagues, I want to give you a little preview. If you would like to join us again, we're going to be going over more of these kind of short acute stress tips with Bruce Perry. We're going to be discussing moral distress and outrage in 2 weeks with Roshi Joan Halifax. And Dan will join us very soon again to talk about thriving with our families, how we can not just get through, but actually help with supporting growth during this period. Esther Perel will discuss harmony at home. This is a time when relationship conflicts and challenges are magnified. And so what does it look like to be resilient with shelter in place at home? Wim Hof will join us to lead us through the Wim Hof breathing method. Wendy Mendez, Eric Prather, and I, and other colleagues at UCSF are studying this method. It looks like a radical, interesting way of reducing stress for those who like it. It's different. It's not relaxing, it's inducing a type of stress through cold, through breathing that we think actually leads to restoration. We'll also be talking about self-compassion and compassion strategies with Thupten Jinpa, the Dalai Lama's translator who has written books on compassion, and again with Eve Ekman. So my heart is so grateful and moved by the work you are all doing. And I just want to end with gratitude for you and the wish for your self-care. And I did put on my favorite dog besides my own real dog, the meditating dog, just to remind us that for those of you who have time to fit in a 20-minute practice, we know that that really helps buffer the stress, whether it's vigorous exercise or yoga. This website we've created gives you online resources of live classes. At every hour somewhere on this globe, someone is transmitting a Dharma talk, a great yoga class, a great exercise class. Everyone's coming together. These are online and live for us. So this website gives us a lot of resources for classes. We also have listed a lot of apps. Some of these come with coaches behind them. People, these companies, digital health companies, are giving these free to providers. They want you to use them. We have one listed here for anxiety, for insomnia. So please check out our website. We will also list recordings of these seminars here. Okay, so I would like to turn this over to Eve Ekman. Thank you so much.
Thank you, Elissa. I am not currently with my video, but hopefully you can start seeing the screen. John, can you help me with the video here? It looks as though I am not able to turn it on. Okay, thank you so much. Just as Elissa said, I'm really delighted to be here with you all. It's super meaningful to have the opportunity to connect and hopefully offer some practices that might be of benefit. So what I would like for us to do together is to start off by just considering, what is the experience of emotion? We're talking about emotional resilience, but what does that actually mean? How do emotions impact our everyday functioning? We're going to look more specifically at anger, irritation, and frustration. This is relating to some of the questions that we received from you before we started this webinar. And then, of course, maybe most importantly, throughout this, looking at what are the strategies that we have available to help working with and regulating these emotions. Just to give you a little sense of where I'm coming from, I, as Elissa mentioned, had the good fortune to be a postdoc at the Osher Center for Integrative Medicine. And in my time there, was able to develop training for undergraduate medical education and graduate medical education for stress resilience. So even outside of these really unique times of the pandemic, of course, healthcare is stressful. You all know the rates of burnout across different fields of healthcare and across interprofessional groups. And so how do we work with the day-to-day stress, which now is even more acute? And I'm relying really on the work that I've been doing for years, which is really encouraging people to get curious about their emotional experiences. I started this work actually as a social worker. I worked at San Francisco General Hospital in the emergency room. I hope some of my colleagues are online now. Just really wonderful experience that showed me how meaningful healthcare work can be. And in fact, that meaning is such a great buffer to our stress. If we keep in mind, as Elissa suggested to us, that what I'm doing is the most meaningful thing I can do, that's a wonderful way to motivate us to really work with and work through some of the more difficult emotions that may be arising. I'll also share with you a little bit about a collaboration I had with the Dalai Lama and my dad around creating an atlas of emotion, or a way for us to really understand and investigate a bigger vocabulary for our emotion experiences. Before we go any further, let's just take one moment right here, with your eyes closed or open, to just notice what is happening in the body. And for some of us, that may feel confusing or strange. You may say, well, I'm sitting or I'm lying down. That's a good place to start, maybe noticing the experience of your weight as you are standing or being supported by a chair beneath you. But then take another moment and notice, what does it feel like to be in your clothing right now? What is the sensation of the texture of your shirt or your pants? And then take one more moment and notice, what is the experience inwardly? It may help to close the eyes a bit. And notice, is there an emotion residue maybe from whatever you were doing before the webinar. Or maybe there's even some emotions around what happens after this webinar, when you go back to work or are doing various tasks. We hold a lot of different experiences of emotion in the body, and one way we can begin to learn how to regulate them is simply by noticing their experience in the moment with curiosity and kindness. So briefly, notice sensations in the face. Notice sensations around the throat and the neck. Notice sensations in the chest and in the belly. Okay, if your eyes were closed, please blink them back open. And that is just a tiny moment for us to take this idea and this intellectual process in some ways of learning about emotion and applying it to this moment. What I found in some of my research with the residents is that they were surprised that when they paid attention to their emotion, there were actually more emotions that were enjoyable in their day than they had recognized. So developing this emotion awareness doesn't just have to be for what's hard. Let's talk a bit more about just the basic foundation of what emotions are and the impact they have on our day-to-day life. Our emotions include what happens from the neck up, so our expression and our communication. What you see here is an image actually of my dad. I'm second generation UCSF, and he mapped all of the facial expressions possible in the human face through our 42 different muscle groups. Some of you asked about how do I communicate to my family to make them feel a bit more at ease when I go to work every day. And it's important for us to recognize that it's not just the words that are impacting how we affect other people. It's also the facial expression and the vocal tone. So when we're thinking about communicating information, especially if we want people to feel safe and at ease, it might be important for us to do that little check-in of what am I feeling right now? And can I come from a place of a bit more stability before I communicate so that I'm not inadvertently emitting these messages of fear or irritation instead of one of calm and presence. What you also see here is an image of emotions that are embodied. Maybe when you looked just briefly at the body, you were able to recognize a bit of tension. Maybe you noticed that there was a sensation of unease or anxiety. This research study that this image is from showed that when people started to really reflect on their emotion experiences, they were able to identify pretty clearly what were the sensations in the body associated with that emotion. And just as Elissa suggested, when we notice and pay close attention to our emotions, when we label them in the body, then we're able to have some space around them, and we can start to understand how we might most effectively respond. I also want to mention, this may be incredibly obvious, that our emotions really impact our brain and our thinking. When we are in the grip of our emotion, for example, frustration, it's as though we're looking through the lens of frustration. Everything around us feels irritating. And though our emotions only last 30 to 90 seconds, if we continue thinking about them, we create a cycle of rumination. So to really keep in mind that our emotions are impacting how we see the world, how we respond to the world, and our likely behaviors. The last part here I want to mention is that emotions are shared. Though we are experiencing them uniquely inside of ourselves, there is actually a factor of contagion of emotions. So that if we are feeling a great deal of anxiety, that may rub off on our colleagues and our family members and vice versa. And for many of us at this time, there is this kind of collective experience of low-level anxiety, and that potentiates our other emotion experiences. We can consider whether or not it's possible for us to bring a bit more calmness as the contribution that we can create into the groups that we're with, whether at home or at work. So basically, I want to tell you simply that there are many different emotions, and they respond to different opportunities and challenges in our environment. We respond differently toward things that make us feel threatened than things that make us feel loss or sadness. And right now, we're going to focus simply on anger and look at that emotion. So this was a question from you all. Many of us are also struggling with anger and the moral injury of working under less than ideal conditions and poor recommendations. I've actually heard this from some of my colleagues I've been working with in the last couple of weeks and developing support and resilience. And I want to first off say that it is totally reasonable to feel anger and totally understandable to have that sense of intense irritation or frustration. And all of our emotions are quite functional. They exist for a reason. They help us move through. The triggers to anger very commonly are kind of being blocked in our progress, and also injustice. So this example is one where we are being triggered to anger by a sense of injustice and also being blocked fundamentally from feeling safe. Now, what does anger achieve? Anger actually has a purpose. Anger helps us feel powerful, and it gives us some energy. In comparison to maybe facing grief of, wow, everything that's being lost in this moment that is so hard, all the connections and all the resources, as well as for many people, just different landscapes within the family of financial security. So when we think of that feeling of sadness, it's heavy, whereas with anger, we have a motivation, and this can be really useful. It can help us advocate. Now, occasionally the way that we respond to anger actually gets us in more trouble. We create division and conflict. So what does our anger really need for us to use it effectively? It actually needs us to be patient and kind. And that patience is one in which we give ourselves the time to relax before we respond. And the kindness means that we're not only being kind to ourselves, anger actually doesn't generally feel good, but also we're being kind to whoever we are angry with. Now, this can be a bit challenging for folks, this idea of, well, why would I be kind in the face of injustice? This person who's asking me to work without a mask, they don't deserve my kindness. I totally understand that point of view. And yet, the point here is, how do we ourselves have as much capacity for calmness? How do we reserve our energy and not feel drained? And honestly, that means unhooking from our rumination of anger. So we can be angry in the moment and advocate, we need more protective gear. But if we go home and we continue ruminating, and it even wakes us up in the night, we're really stressing ourselves out. And at that moment, some kindness of, you know, all of these systems right now are so taxed, actually nobody knows the right thing to do. That's the kind of kindness we can, work around while understanding what's happening. I want to just briefly share with you an idea that helps unpack emotions a bit further. Understanding that emotions have a trigger, an experience, and a response. When we are triggered to an emotion, it actually happens in under 25th of a second. So we are going to be triggered immediately. Maybe we receive an email telling us that today a certain amount of people have masks and others do not. And the experience of that physiological response will be immediate. So the response area of what we then do with that emotion, that's where we have some room. That's where we might have some choice and be able to do something that's slightly more effective. So when we think about developing and working with emotional awareness, what we're actually thinking about is, can we improve our constructive responses? When we have an emotion that triggers us, such as being afraid to go into work the next day, we just don't know what will face us. Very normal and understandable emotion, an emotion that's designed actually to help us. So we think, I'm not sure what will happen tomorrow, I feel a lot of anxiety. A constructive way to respond to that might be to use the kind of sleep hygiene that Elissa mentioned of, okay, I'm not sure about tomorrow, there's a lot ahead, I'm gonna go to bed early, I'm gonna not look at any media that will make me upset, I'm gonna do whatever is possible that is soothing for me in this moment. Versus we have that same feeling of anxiety and overwhelm, but we respond by maybe trying to distract with Netflix, or maybe trying to eat ice cream, or maybe drinking red wine. And in fact, that really destroys our quality of sleep. So the same emotion, the same trigger, the same feeling, but our response has changed. So I want us for a moment to come back to that simple practice of noticing emotion in the body. So I invite you again to close your eyes if that's comfortable. And this time, as we notice what's happening in the body, really do so with a lot of kindness. If it doesn't feel as though there's anything in the body right now, you're feeling neutral or relaxed, maybe you bring to mind an event that happened the last day in which you felt somewhat frustrated or irritated. Memory is a powerful elicitor of our emotion, and if we bring it to mind, often we will get the embodied response. So inviting in that memory of frustration or irritation, just briefly, as though it were a snapshot, and then letting it go. And bringing all the attention and awareness to the sensations in the body, noticing what has been stirred up. And as though we were welcoming a dear friend, inviting these sensations in with kindness. And then imagining as though we could provide space for all of these emotion experiences, that our breath helped create a little bit of room in between what could feel like a dense emotional experience. So as we inhale space into the sensations. And as we exhale some kindness to the part of ourselves that may still be a bit frustrated. So 3 more breaths here. Inhaling, inviting spaciousness. Exhale, kindness. And then taking a moment to return to the sensations in the body. Notice, have they shifted or changed at all? And gently, if your eyes have been closed, blinking them back open. Thank you for giving that a try and just starting to notice and begin familiarizing yourself with the felt experience in the body. Some of the ways we might further this familiarity is noticing the quality of sensations in our body, maybe tight, heavy, hot, tingling, and really giving ourselves that opportunity. We can also, as Elissa mentioned, really improve our vocabulary of emotion, improving what is a granularity, really noticing, okay, I'm angry, but what kind of angry? Am I annoyed? Am I frustrated? Do I feel maybe all the way to fury? And this is a simple example from the Atlas of Emotion website. And you can use this with yourself, your colleagues, and your friends. So when we think about the strategies, we think about increasing our emotion awareness, noticing and being clear on what is making us emotional. What's the trigger? What's the felt experience? Where is our opportunity to respond in a constructive way? We have this granularity or ability to be very specific about what are the sensations in my body or what is the specific emotion I'm feeling. There's also the kind reappraisal. So whatever we're feeling, frustrated, maybe we're feeling guilt that we're not doing enough, maybe we're feeling sad, to just kindly accept and notice these sensations. And then the last strategy I want us to end with is to increase the opportunity for pro-social emotions. At the Greater Good Science Center at Berkeley, where I work, we often really remind people, as Elissa did, that social connection is so important for regulating our emotions. And we need to have actually meaningful social connections, ways that it feels better to be together. So we want to share with you a gratitude kit. So a way that you can download PowerPoints and activities and exercises that really help support a feeling of what I'm doing here is meaningful. And in fact, I'm grateful for this opportunity. Forced gratitude never feels good, but is there something maybe each day or in between our shifts we can focus on that gives our mind that ability to, in addition to working with what might be hard, increasing what is good and already there? We also have an online institute for healthcare providers coming up with Elissa and some other faculty from UCSF, Jyoti Marvin, Dacker Keltner from Berkeley, and Jamil Zaki from Stanford. And we're looking forward to sharing more of these ideas of stress resilience with you there. So I want to thank you so much for your kind attention and really thank you, Elissa and Dan and UCSF, for giving us this opportunity to be here together.
Thank you, Eve. That was really wonderful. It's an honor to be here with everyone. You know, I'm excited to join you, all of you who are here together, almost 3,000 of us. And it's really a pleasure to dive into some of these issues that we're all facing. Now, for you, in the questions that came up, what we've tried to do is tailor our brief talks and practices to these really important challenges of what do you do when you're a frontline worker in all the different medical professions that are facing the challenges that can sometimes feel like threats. So I remember when I was in medical school, no one taught us about these issues, about emotions, or about what you can do to deal with stress that Elissa Epel and Eve Ekman have just been providing for us. So for many of you, as medical professionals, what we're going to talk about now may seem like it's new, but I hope you'll see that these things that we've been talking about this entire session are actually quite useful. We're going to talk about how to turn a sense of threat into that sense of challenge that Elissa spoke about. So as Eve spoke about, we can actually approach our emotional experience with awareness and with a constructive way of being. So the first thing to say is that you have the power to actually control attention. Now, of course, attention, which is a way of thinking about a flashlight that shines a light on certain energy or information that's in your environment. For example, if you're racing down the corridor in a hospital, you have to focus on where you're running. You have to focus on the room. If you're now with a patient, you're focusing your visual attention on what's going with the patient. What we're doing today is inviting you to actually focus your attention on your inner experience. And we can do that in a way that is very distracted, and you just say, oh my God, I'm feeling agitated, I'm feeling overwhelmed, and not approach that in a way that is with a couple of things you can simply remember with the acronym COAL. That is being curious, as Eve mentioned, being basically having this approach, what's really going on with me? Being open, and this openness means that you want to see things as they are actually unfolding. So people sometimes talk about being in the moment or being present, and this is this quality of openness. So if you say, for example, I don't want to feel angry, but there is anger present, that would not be being open. And the research is really clear that when we can come with a curiosity and an openness, we can then provide this really key thing of acceptance, which isn't to say, I'm just going to be passive, and if there aren't, enough ventilators, or if there isn't enough personal protective equipment, I'm going to be okay with that. That's not what acceptance is. Acceptance is not passive like that. It's a very engaged way of being present and saying, I see what is, and this is how it is. And in this moment, how am I going to provide a constructive approach to what actually is going on? And when we bring a sense of care and kindness and nurturing to our own inner experience, let's simply call that a word that when I was in medical school, I never heard used once, which is the word love. And we say that in a professional, scientific way, this positive force of life, and in many ways, what's related to why a number of us, many of us, perhaps most of us, choose to go into the medical profession, that meaning, that purpose of why we decided whatever branch of medical work we're doing to be of service to others comes from this deep place of love. So COAL is something you can remember to bring curiosity, acceptance, and love. Now, it turns out that you can actually train this quality of a COAL state of mind. Some people might call it mindfulness or mindful awareness. Some people would call it presence. Others might call it compassion and mindfulness. But the three pillars that are something you can actually use this pandemic to be an invitation to you to cultivate resilience with these three pillars. And the research is quite remarkable. When you train your mind to make attention, that process that is directing energy and information flow, when you stabilize it, we call it focused attention. You can do a simple practice, and we'll do one in just a moment, that actually teaches you For example, if I choose to focus on the breath, then when the in-breath is there, I'm with the breath in. The out-breath is there, I'm with the breath out. Let's try that right now, just to feel that. Just take a moment right now and locate your breath however you feel it most naturally, the nostrils, the sensation of the air coming in and out, the chest rising and falling. Sometimes people breathe and they can feel it from their abdomen as the diaphragm pushes down. Let's just take a moment to have focused attention on the breath, in and out, in and out. Now, when you train the focus of attention, and we did a study in our research center at UCLA that showed that if you just do that simple practice over 8 weeks, you get more improvement in attention than you'd get by using stimulants for people with attention deficit. Quite remarkable, but you can train the focus of attention. Now, the second pillar, open awareness, is really fascinating because you can do this in the wards. You can do this on the hospital floor. You can do this on your breaks too. You can do this when you're home. Open awareness would be where, in the formal way, what you're doing is letting your mind just sense whatever arises as it comes and goes and comes and goes. What stays in common is awareness. And the object of awareness, whether it's the breath, a phone ringing, a sound in the corridor of the hospital, what that does is it lets you see that what is the common ground for all of us is this awareness. And for example, if you do a breath practice and you're no longer on the breath and your awareness is now filled with an object like worrying about the future or thinking about what you're going to get for lunch, these objects of attention enter awareness, and you can learn to just have this open awareness and realize, oh, I'm not on the breath, and redirect your attention. When you do all of this, realizing that we all get distracted, and when you do it with kindness, you develop the third pillar of kind intention. Now, you may be sitting there or standing there saying, you know, this is just too hard. How do I do 3 things? Well, we're going to do a practice, or at least look at a practice that has all 3 in one. But if you do this over 8 weeks, research shows, and this is quite remarkable, published in some of the most rigorous, peer-reviewed, empirically based scientific journals. If you do what we can call 3-pillar practice, training attention to be focused, training awareness to be open, training intention to be kind, when you do those things, if you told me this 20 years ago, I'd say not possible, but this is what research shows. You will increase what's called integration, which is the linking of differentiated parts of the brain in both its structure and its function. And regulation emerges from integration in the brain. So regulating your emotion, your mood, your stress, your attention, your thought, your behavior, even your morality and your relationality, all those things come from integration in the brain. And integration in the brain is the best predictor of your well-being. So amazingly, 3-pillar practice, focused attention, open awareness, kind intention training, build integration in the brain. You'll reduce stress. And these last 5 elements are basically the molecular mechanisms of well-being in your body. You're going to reduce stress hormone cortisol. You're going to enhance immune function. You're going to improve cardiovascular risk factors, lowering cholesterol, lowering blood pressure if it's elevated. You'll actually reduce inflammation by altering the non-DNA molecules, the epigenetic regulators, on top of regions of the genome that control systemic inflammation. And you're going to even optimize the enzyme that Elissa Epel and her colleague Elizabeth Blackburn have studied, telomerase, which repairs and maintains the ends of the chromosome. So as Elissa Epel and Elizabeth Blackburn have shown, it even slows the aging process. This state of presence is something you can cultivate. And so what seems like an absolute horrifying moment in our collective human unfolding, which it is, can be used to actually invite you to take these threat states, as Elissa Epel beautifully showed us, and turn them into challenge states. And at the same time, building these 6 changes inside your body with what you do with your mind. So then you say, well, okay, well, how would I do that? Well, we heard from Eve Ekman that it's so important to be aware of sensations in the body and feelings. And I, as an acronym, not like the acronym SIFT, because what you can do is with a cold state of mind, being curious, open, accepting, and loving,
Surprise, I'm back. Due to the uncertain times, that includes also the uncertainty of our internet right now. And I know where Dan was talking was, how do we work at a more granular level with these sensations in our body? And since we have this time remaining together, I thought it would be worthwhile for us to continue, Elissa, with some of the main questions that folks were really bringing up for us.
We have about 5 minutes left, and it would be great to talk about some where the rubber hits the road. How can you find ease in a chaotic world, in a chaotic day? What we just saw was Dan froze. I'm sorry that we didn't get to hear him lead us through the wheel of awareness. The good news is that he has many wheels of awareness of different time lengths. So on our UCSF coping guide, we have one that's 15 minutes. And on drdansiegel.com, he has varying lengths. If you have time to do a longer one, your body will thank you, because you can deeper states of relaxation. There's also different meditation recordings. And really, my point is, find what works for you. These are powerful strategies, and it really depends on what you like. So I'm sorry he didn't get to lead us through the wheel, but you can do this on your own, and I encourage you to. So what I was going to ask you and Dan, and hopefully Dan can join us for this, is, and I can give you my own simple answer, but really is, how can we really cherish and be present in the moments that are safe in our day?
Yeah, I think that's a wonderful question. One thing that's come up in some of the work I've been doing with residents and trainees in the Department of Pediatrics is there's even a sense among some healthcare providers that, you know, we're not doing enough, right? So am I allowed to feel okay and relax and enjoy myself, where I know that some of my colleagues are struggling and suffering? And in this case, we see where guilt can almost get in the way of us being able to relax and be at ease. So I think your question is a beautiful one, and it does include, once again, bringing awareness to the emotion so that we can then give it an opportunity to share its message with us, which is, I really care about other people who are suffering and struggling. But also remember that us doing okay, us creating that ground of self-care, is absolutely the most important thing we can do for those who love us, for our patients, and for our colleagues.
Thank you so much, Eve. Welcome back, Dan. We're so sorry to have lost the wheel with you, but we will be sending out an email that has links to the different recordings.
Wonderful. I don't know where you lost me, but I can certainly continue, or wherever you're at, I'm happy to do it. There must have been an internet glitch down here.
Yes, we lost you with SIFT. So I think what we'll do is send them links to your wheel of awareness, since we only have about 5 minutes left.
Okay, great. My apologies for the internet.
There are things we can't control, and that's which is.
Can I just speak for 1 minute about it? Just to,
yes.
Yeah. So we won't do it here, but what we can say is that your ability to do a practice, this 3-pillar practice, which distinguishes awareness, and this is a visualization of it, in the hub from what goes on as the object of awareness on the rim. And this is the last slide I'll just show. You can do this practice from our website for free. And what people have described who are in the medical health professions is that the ability to expand that container of consciousness, the metaphor of the hub, is basically, just to give you this one metaphor, if your container is really small, like most of us are in the medical profession because we're never trained to do this, then when a stressor can come, think of it as the metaphor of a tablespoon of salt, it's dumped into a small little espresso type size container. It's too salty to drink that water. But with a simple practice like the Wheel of Awareness, which has all three of the elements of the pillar, as you open up the container of consciousness, what happens is now, let's say you have a 100-gallon container, a stressor like working at the hospital, all the surge that's about to happen is happening, you're worried about it. Now that stressor, that tablespoon of salt, dumped into your now expanded container of consciousness, in 100 gallons mixed up in that water, the water is something you can drink. You stay constructive instead of the experience being destructive. You stay in a challenge state instead of the reactivity of a threat state. And that's what expanding awareness can do with this Wheel of Awareness practice. So thank you very much. It's where I had to go when the internet shut down and I had to figure out some way to get around that to get back on with you.
Yes, thank you so much. I've been at enough workshops and conferences with Dan to hear people come up and say, you know, the Wheel of Awareness changed my life. So there is something for everyone. The Wheel of Awareness is phenomenally visual and conceptual. So that might, I suggest you try it. The Wim Hof method that we'll talk about later is a totally different thing that other people say, this is what saved me. So, you know, so really finding our modality of becoming grounded in the moment is so important right now. We don't know what's next. This phenomenal moment of uncertainty is what I wanted to address as the last question for our speakers. And the question was, how can I be okay when things are not okay? And one thing I heard that I felt was helpful is that our future is uncertain. No one can tell us when there's a surge, how this will end, who will be okay. This is hard to be in and live with. But our body is always here only in this moment. It's our mind that time travels. And so when we can actually come back to our body and say, I'm actually going to see what emerges. Let experience unfold as it unfolds in front of me, rather than me reaching out with time travel, worry, anxiety. Because out here, it's very scary. Our mind goes crazy with catastrophic thoughts. But in the moment, when you can be safe, let yourself be safe. Remind yourself that you are okay, that you can feel your body, that you can take these breaths. These are the short-term strategies we need to start using effortfully through the day. So that was my tip: is let time unfold as it does, rather than us going out there and trying to figure it out. Dan, did you want to comment on how can we be your suggestion to all these providers who are in the hospital today and dealing with, the threats and the fears?
Yeah, no, I think, what I think Elissa, Eve, and I are trying to convey is that rather than trying to avoid inner experience, like a feeling of threat, avoiding it or wishing it wasn't there, what we're suggesting based on research is that if you can find this way to approach rather than avoid that state of threat, amazingly, it's very clear that when we hold in awareness, even uncomfortable, painful things, we actually do well. We actually have good forms of stress in terms of we're activated rather than becoming either deactivated or becoming chaotic. And you can actually do this. If you start a simple practice, the breath practice you learned about with the counting, Eve's practices of really being aware of what your body is feeling, you could try the wheel where you get all three pillars. And when you do this, you'll be amazed. You can actually transform what before felt completely overwhelming to something that is really nothing you might choose, but something you are now capable of dealing with. And that's basically what resilience is. And that's what we hope these suggestions are providing you actual practices for your life. And thank you for all the work that you're doing for all of us, because the purpose of being in the medical profession, the thing that drove us there, the meaning of it, is what we have to remember. Bring that back to mind is what remembering is, because we're in this together, and however we can support each other and move through this pandemic, that's going to be a way where we can turn these really painful days and weeks and months ahead into something that grows us individually and grows us collectively as a humanity.
Beautiful. Thank you so much. Thank you, Eve and Dan. We are so grateful for the work you are all doing. Please send us feedback, suggestions, and maybe when you hang up, if you have a moment to try your 1 or 2 minute check-in, you have a lot of ideas now, and text a person.